the autonomic nervous system of vascular function. It is a mechanical device and platform that tests and provides risk assessment of cardiovascular and metabolic disease. It allows the detection of metabolic diseases such as diabetes and coronary artery disease. The values for these markers are derived from different modalities and processed utilizing software-facilitated algorithms to generate a score for each assessment. This test can also objectively evaluate the lifestyle with measurements of body mass and fitness. Now, the areas of assessment may include small fiber neuropathy, autonomic neuropathy, cardioautonomic neuropathy, insulin resistance, endothelial dysfunction, central aortic pressure, and lower artery pressure. Now, I want to describe what the nervous system is. There are two nervous systems. One is the central nervous system, which is the brain and spinal cord. The other is the peripheral nervous system, where information is processed and then sent out through the nerves. This system does what needs to be done. Now, the autonomic nervous system is the one that's responsible for control of bodily functions not consciously directed, such as breathing, heartbeat, and digestive processes. It's composed of either the sympathetic or parasympathetic. Actually, the peripheral nervous system can be divided into two parts: the somatic, which is responsible for voluntary action, and the autonomic nervous system, which involves unconscious functions and processes that are not under voluntary control, such as function of the organs and glands. Now, the sympathetic nervous system is associated with the flight or fight responses with the body reaction required to respond to an emergency. When the sympathetic nervous system is in action, you will do better. You will experience better breathing and stronger heartbeat. This system controls the body's response during perceived threats. The neurotransmitter norepinephrine is what modifies the target organs to make them more conductive to activity, body movement, and may also cause increased energy use and increased wear and tear. Now, this is a picture of the sympathetic and parasympathetic systems, and you'll notice on the left is the parasympathetic and on the right is the sympathetic. Now, the parasympathetic nervous system is that associated with the rest and digest responses. Examples would be the increase of saliva production to increase digestion in the gut and increased gallbladder function, which assists in the digestive process. It controls the body's response while at rest. These are body reactions needed to restore energy and rest to the body. The neurotransmitter is different. It's an acetylcholine, and a lot of it works through the vagus nerve, which is there on the right. Now, the first test is going to involve the sudomotor risk. This is what checks the nerve fibers that cause sweating and are responsible for pain. This device uses software that analyzes sweat responses after exposure to electrical stimulation, which the device provides. This is controlled by a division of the sympathetic nervous system and involves the release of acetylcholine. Acetylcholine increases microvascular flow and provokes sweat output. Now, the way this machine measures the sudomotor risk is through two markers. One is nitrous oxide peak, which is a marker of electrical skin response to nitrous oxide production, which the system picks up. This marker reflects microcirculation blood flow, and decreased nitrous oxide response suggests microcirculation issues. A low number indicates poor microvascularization and an increased risk of distal neuropathy. Neuropathy being nerve dysfunction. High numbers suggest good vascularization. It also measures the sweat peak gland density, which is a marker of sweat gland density. This reflects the postsympathetic nerve activity and reflects what's going on with small C fiber nerves. Low numbers are an early detection of neuropathy. Now, this is a picture of a sweat gland. Here's a nerve cell. I have to add that the glands that this test measures do not involve the myelin sheath. Now, this is an example of the sheet. You'll notice on the left that it's measuring the nitrous oxide peak there on the left. It also measures the sweat peaks. Now, this is processed by software to create a number called the small fiber risk score. This gives an idea of the density and the function of the small fibers. You'll notice it goes from phase 1 up to phase 4, and it gives us a risk of how well the nerves are operating, and this suggests that you have, in this case, a mild C fiber neuropathy or inflammation. Now, a small fiber risk score is derived from the markers and process used utilizes software-facilitated algorithms. Small fiber neuropathy occurs when there's damage to the peripheral nerves entirely made of the small myelinated or unmyelinated C fibers. It includes both small somatic and autonomic fibers. These sensory fibers can involve thermal perception, nociception, and pain. Now, the doctor may, after determining what the small fiber risk, may pursue further testing, which includes skin biopsy, nerve conduction studies, blood sugar testing, or possibly a cardiology workup to include an EKG and echocardiogram, because this doesn't is influenced by the circulation. Now I'm going to move on to something which will be a test of the autonomic and cardiac autonomic neuropathy, and this will include heartbeat variability analysis. Now you'll notice here it says power HR. That means high frequency. Now, one of the measures we have learned that in order to assess the autonomic nervous system, the heart rate variability, that is the changes in heart rate from beat to beat and a blood pressure between a resting state and a Valsalva maneuver, deep breathing, and active standing, can give us a clue as to how well this type of nervous system is working. Heart rate variability refers to the variation in the intervals between heartbeats. The variation that we experience in our lives is a balance between the sympathetic and parasympathetic. The sympathetic being the more or less the gas pedal, and the parasympathetic being the brake pedal for the body. Now, this is an EKG that demonstrates the R waves, which is how the device measures the R wave variability. Now, this variability is modified by ventilation, barrier reflexes or pressure reflexes, genetics, hormonal, environmental factors. When the heart rate variability is low, there is a predominance of the sympathetic response, which means the body does not handle stressors well, and you could have arrhythmias. When the heart variability is high, which is good, the heartbeats have intervals varying lengths, and dominance of the parasympathetic is there, and that means the body recovers well. So that means when the heart variability, that means the body reacts with differing time measures of RR. That's good. Now, there are measurements of the heart variability based on the frequency. That means how many times per minute this occurs. High frequency reflects that there's a lot of vagal activity or parasympathetic modulation. That means there's a lot of more frequent variabilities. That's good. A low frequency reflects primarily sympathetic, which means it basically is the variations are low, which means it's not good. This is this is showing that the score is kicked out, which device determines. Now, there is a ratio involved of these two, and that will give us an idea of what's parasympathetic and what's not sympathetic. An LFH ratio, which is indicates the balance of the autonomic nervous system. When this ratio is less than 5, that means we have a predominance of parasympathetic, and that can be found in fatigue or depression. The opposite, if it's high, means that there's sympathetic predominance. It means the sympathetic system's working in a high output, and that can occur with mental stress, anxiety, and adrenal burnout. Now, before we approach this, we begin a baseline evaluation. At rest, we check the heart rate variability. We check the high frequency parasympathetic at rest. We check the sympathetic at rest, and we get a balance based on the ratio. Now, there's 3 things that we do to try to test this beyond rest. One includes a Valsalva, which is where a patient takes a deep breath and holds it in. Blood pressure usually falls, and there's an increase to heart rate. That means the sympathetic's kicking in. It also occurs during deep breathing. There's increases in inhalation of the heart variability, and that suggests parasympathetic during the exhalation phase. There's also standing, in which the sympathetic system kicks in. Now, these are markers of the parasympathetic, which include the Valsalva sensitivity, expiration-inspiration ratio, and something called active standing, where we measure the RR intervals at approximately 30 seconds and 15 seconds as we're standing. These are all measures that the machine takes into account, uses algorithms to produce scores, which we'll get into in just a minute. These are sympathetic markers that the machine derives from the tests that we do. Now, there are two scores. One is the autonomic dysfunction and the cardiac autonomic neuropathy. The autonomic neuropathy is when there's damage to the autonomic nerve fibers that innervate the blood and heart muscles, resulting in abnormalities in heart control, vascular dynamics, and the body's ability to adjust the blood pressure. Now, if this were to occur, we would have a high score. There may be additional testing as noted on this. Then there's the cardiac autonomic neuropathy. Now, this is a little bit different. This is dysfunction and damage to the nerves that control the regulation of involuntary function, which affects the heart. This score usually we get a measure of this score depending on what happens with the three phases. If there is a failure of a response with either the sympathetic or parasympathetic in two of these three phases, which include Valsalva, deep breathing, and active standing, that suggests we may have a cardiac autonomic neuropathy problem. And that usually translates into a failure of the sympathetic or parasympathetic system to regulate the blood pressure. What goes on in the body is there's a back and forth of sympathetic, parasympathetic, and this device measures where we are with that in terms of dysfunction or lack of, and gives us some idea of how that reflects on the heart. Now, cardiac autonomic neuropathy, where it means that there may be a lack of total function in the ability of the heart to respond to different position changes or Valsalva, may involve additional testing, which include blood sugar, EKG, echocardiogram, cardiac ultrasound, Holter monitor, or a brachial index. Now, we're going to move on to something called a small artery risk. The small artery risk is also known as endothelial dysfunction. Now, endothelial dysfunction is a marker of the net effects of damage from risk factors on the arterial wall and its capacity to repair. It's the earliest sign of coronary vascular disease. It's detected as the pressure of a reduced vascular response to stimuli. Once this is identified, we can expect to see nitrous oxide production issues with decreased permeability to cholesterol and a stiffness over the artery over time. Stiffer the arteries, faster pulse wave travels, and the worse score and the higher risk that we have. What it basically means, it gives us an idea how stiff the vessels are and how they are going to, and what kind of risk that may be for hypertension, diabetes, and TIAs. It can be found in homocystinemia, postmenopausal smoking, diabetes, hypercholesterolemia, and hypertension. Now, the way it evaluates this and gathers data from what we call plasmography. That's where you put your finger in. It's a pulse ox, and it gives a wave. And from that wave, the software analyzes it and gives us data. And in this case, the small artery disease showed that there was endothelial impairment of a mild amount. Now, the gist of this is that it is a non-invasive test for arterial elasticity. The pulse wave in the artery is measured from the heart's contraction as the heart's pumping out systole to the small part of the fingers. The test is simple, and the waveform that is occurred is evaluated by the software. Now, this is a picture, a diagram of what an endothelium is. It's the inner lining of the cell, and basically, if the test is high, we get a feeling that this inside of the endothelium, the blood vessel wall, may be thickened. Now we're also going to move on to something called PTG, that is the plasmography. This also, in addition to telling us how the endothelial lining is working, can give us an idea through algorithms and software if you maybe have a tendency towards insulin resistance. Now, insulin resistance is the diminished ability of cells to respond to the action of insulin transporting glucose from the bloodstream into the muscles. Insulin resistance typically develops with obesity and may occur before the onset of type 2 diabetes. Basically, we can get an idea of what may be lying ahead. If the insulin resistance score comes out, the doctor may elect to do certain markers such as an HbA1c and a blood glucose test. Now, it also tests by plasmography and blood pressure cuffs central aortic systolic risk. This may give us an idea if we're dealing with early stages of hypertension. This is the blood pressure at the root of the aorta as it comes out of the heart. Studies have shown the importance of central aortic pressure and its implications in assessing how well our blood pressure medicines are working. Additional testing may include an HbA1c and a blood glucose. And then finally, we can do, by virtue of what we call an ankle brachial index and blood pressure cuffs, we can find how much peripheral artery disease that may occur, that is hardening the arteries of the small vessels. That also may involve additional testing. In summary, this device does give us an idea where, based on the algorithms and the information, how much body fat may be occurred in the right on the blood composition chart, as well as a fitness chart based on what parameters and modalities are measured. It also gives us an idea of fitness markers, which circle back to some of the earlier modalities. Thank you.